is a deep plane facelift?
Well, deep plane surgery is, I find, fascinating. I've been lucky enough to have developed some techniques over the years that have made me a frequent lecturer on the national circuit and even overseas somewhat. And being on that circuit not only is kind of fun for me to teach other doctors what I'm doing, but it's allowed me early access to what other doctors are doing because we have lunch together and talk. And I was teaching a course out in California probably around 15 years ago where I was talking about some of the mid-face stuff that I'm doing, and I had lunch with this doctor who I can't even remember his name now, who told me about deep plane facelifts and how he does them, and showed me his slides, and I realized that I could incorporate what he was doing with what I was doing. So I went to the cadaver lab and did a bunch of dissections, which I know is not something most people want to hear about, but that's how surgeons should approach new things. And incorporated what I was doing with what he was doing, and have come up with this. It's a deep plane lift, but I call mine, it's actually a 3-layer lift, but without getting too technical, it's a modification of what some doctors are calling a deep plane lift. Now, what's the advantage of doing that? Well, deep plane surgery, I found, allows me to get a elevation of the soft tissues of the midface, jaw, and neck without making people, or worrying about making people look pulled. The most common lift done by most plastic surgeons is a SMAS lift, or a variation thereof, which is fine if that's all they know how to do. It's not as complicated as what I'm doing. But the disadvantage is that if it gets overdone, you look like you're walking through a wind tunnel. And that look can take a while to go away. You won't get that with the procedures that I use. So a deep plane lift is, as the name applies, deeper into the face. I'm lifting structures that are more firm, have more texture, more strength to them. And the reason I do that, again, is to make, because it looks more natural, lasts longer. The reason some doctors, or a lot of doctors, don't use that approach is the deeper you go, the more you better do a lot of facelifts, because the anatomy gets more complex. So you don't want to have somebody doing a deep plane lift who hasn't been doing this sort of work for years and doesn't do it routinely.